Well, to talk about the COVID situation in the country, we're now joined by Dr. Bhanu Pratap Singh, founder and director, pulmonologist, Midland Healthcare and Research Center from Lucknow, and Dr. Adityan Guhan, director, AG's Healthcare from Coimbatore. Thank you so much, doctors, for joining us. And first, Dr. Bhanu Pratap, if you saw that report, it's very, very saddening to realize that so many doctors have lost their lives. And what's also very worrying, even in Delhi recently, we've had 2 doctors who passed away after they were fully vaccinated. Today morning, we got the news that another well-known doctor in Delhi, Dr. K.K. Agarwal, too, has passed away. And most of these doctors were fully vaccinated. So that remains a big worry.
Yes, definitely. It is really a cause of worry. We are already short of the doctors and those who are working in this COVID situation. And we are losing doctors one by one. And more than 1,000 doctors has already been mentioned by the IMA president that they have lost their life in the last 1 year due to COVID. So this is really a worrying situation. Another thing which is very important is that why all the doctors have not been vaccinated till date. So everybody should have been got the job, basically the jab, and vaccination should have been done so that they can be prevented. As you all know that all the vaccines are very effective in preventing the serious nature of the disease in COVID. So everybody should have been vaccinated. I think
right, sir,
that is another thing is that
who
proper
passed away
did
receive both the vaccine jab. So that is also worrying given, these
yes.
are breakthrough cases. And is it because they're exposed to so much infection and the viral load is just too high?
There are different reasons actually. Probably it is the variant might be the responsible which is causing infection and not getting covered with the vaccine. One reason. Another thing is that in spite of the inoculum, the viral load is too high when the patient got infected. So in that case, the cytokine storm is also very high and the complications are also too much. So in that way, if your inoculum is very high, large, then you get the very severe reaction. And vaccination probably like with the mutant strain also.
All right, let me put that to Dr. Guhan as well. We're still waiting for more information about, the new strain of COVID that is prevalent in many parts of the country and the vaccine efficacy, though there have been claims that it is effective against this new strain as well. But we are seeing these breakthrough cases. A lot of them we do, as Dr. Bhanu Pratap said, see a milder disease. But what's worrying is when we have situations like this, when fully vaccinated doctors, die of coronavirus.
No, I want to share my view here. Actually, even in the when B1617, the Covaxin only covers around 30 to 35% of the fully vaccinated adults. So in a hospital setting, we don't expect a single strain. We have multiple patients and multiple strain. Especially young doctors have a very rapid immune response. And as you all know, the cytokine storm is too high. So I think, and I also see that the double masking has not been prevalent everywhere. Still, we are speaking a lot about double masking. I never see my colleagues or anyone with a double mask. Like, we have to be more accurate in the primary prevention. And secondly, doctors has to be fully vaccinated. The entire medical fraternity has to be vaccinated. This will definitely prevent the death rate.
Right, absolutely. We definitely need all the frontline workers, healthcare workers to be totally vaccinated by now. Now, I want to talk about another issue. Dr. Bhanu Pratap, the convalescent plasma has finally been removed as one of the therapies for treating COVID patients. And this is something that many doctors have been asking for because it just takes up too much energy and it doesn't have any beneficial effect. Are you now hopeful that this demand for plasma will stop?
Definitely. Actually, from the very beginning, it was a very controversial issue in the management of the COVID-19. Actually, the timing was also very important, and US FDA never approved this therapy. The NIH also did not recommend the use of plasma in the management of the COVID-19. However, in our country, we have been using it, and although the recommendation initially was there, and people were using because of that, and there were equivocal reports of its efficacy in the management. So now it is very clear that probably it is not going to help the management of the patient with the COVID-19 giving the plasma therapy. So in this way, this will have a very clear vision for most of the people. People have been wandering from here and there for arranging plasma for their thanking those who are admitted in the COVID wards.
Right. And Dr. Guhan, again, I hope that message really goes out, because you still had doctors asking for plasma. You also have family members, because hoping against hope that anything works, asking for plasma. It was something that we were very, very hopeful about when it started last year. But, study after study has proven it's not effective.
Yeah, the drawback with plasma is the plasma injection itself produces a lot of immune reactions, like what the virus evokes from the body. Like if the virus enters, you all know that it evokes a cytokine, it evokes the immune response. Same way, when the plasma is given, there's a lot of antibodies being generated, and the plasma, it's like a blood donation. So it has a lot of implications and a lot of cytokines produced from the plasma itself. So it has been proved it is very ineffective.
Right, absolutely. And there are worries also that it could cause the virus to mutate further. Ineffective therapies sometimes do cause more mutations in the virus. Already we're dealing with variants.
Yeah.
Dr. Bhanu Pratap, another issue that has been spoken about by many experts is the overuse of steroids early in the COVID treatment. A lot of people also, because you have whole families that are affected by COVID, sometimes they consult the doctor for one patient, and everybody just uses the same, consultation to medicate themselves, and that's another worry.
Yes, definitely. Actually, steroid has much misuse in this COVID-19, and probably it is the wrong timing and the wrong doses, which has been responsible for causing this lot of complications, which already we are seeing today. And people have been rather advocating blankly that you should go for the steroid in every patient of COVID many times. And this has been a wrong habit. And unfortunately, that has led to so many complications in the COVID patients. So it is the timing of the steroid which is very important. It should not be in the first week. And also, once the oxygen level is dropping, only then steroid has to be given. So that thing is very much important. At the timing of the steroid and its doses also. Many times people are using very high doses, which are not required. And that is causing problem in these patients and causing the very uncontrolled sugars and leading to a lot of complications.
Right, Dr. Guhan, it's also being seen as one of the reasons that maybe a lot of young people are getting so severely affected by the disease.
Yes.
Yeah, actually, I would say I had a point to say here. The first wave misguided us. Actually, the first wave, lot of senior people got sick. So what we did is we vaccinated the 60 plus people first. We didn't account for the breadwinners or the most active people who were the young adults, like 25 to 55, were going out and doing job. So we should have actually vaccinated the breadwinners or the young people along with the elders. So I think because of the first wave experience, we didn't scientifically approach the second wave. If we would have vaccinated more on the young adults, I think now this devastating situation would have been handled well.
All right. Well, that's a whole other debate to have about, our vaccine policy and the manner in which our vaccine rollout took place. But thank you so much, doctors, for sparing your time and joining us on the channel this morning. Yeah. Thank you.
Welcome.
Well, with that, time for us to slip into a short break. We'll get you more news.